Midwifery is a highly skilled profession, and you need quite a lot of skills, knowledge, etc. to enable women to have the best experience possible and babies and their families to have the best start in life. And basically what our programme aims to do is equip students over 3 years where they'll gradually build on their knowledge, skills, confidence, etc. To be able to deliver the care to a multicultural society. We've had lots of conversations with women and families in the community here, also with the staff as well, to see what it is the maternity services needs. So some of the key areas are perinatal mental health, and in conjunction with your perinatal mental health will be your own mental health and looking after yourself and using the support of your network that we develop around you. Other things include health promotion, and again that's threaded through all of the modules. You'll find that it comes out because part of your role as a midwife is that best start, so you need to be able to help families help themselves. We're also very keen on human rights, because when you look at the recent reports that have come out in relation to midwifery, people don't feel listened to, and that's not just the families, it's also the staff themselves as well. So it's that those human rights, the right to be listened to, the right to be heard, the right to say no, etc. And it can sometimes be a bit scary when you talk about human rights, but we do it in such a way that it's very gradually introduced in year 1 and then built on to year 2 and year 3. We've got a purpose-built midwifery suite for the students to learn and practice in a safe environment. We have the most contemporary models that you can use. Things like our Sim Mum, Sim Baby are very lifelike, so it gives you a better realistic feel of what it is to be a student midwife and a midwife. We have what's called an immersive suite, where you can sort of put on the walls any particular scenarios you want to. Students can engage with them as well, so it makes it a little bit more realistic. We've also got like a mock ward, maternity ward, what we can use either for childbirth or we can use it for postnatal or whatever we choose to use it for. We have a birthing pool with like a birthing ball and things to try and make it as homely and as friendly as possible, and again to give those students, empower them to be able to empower the women to do what they want, what their body's telling them to do while they're labouring. We also have a postnatal room, and then we've got the home birth room, which is the current room we're in. We'll also use this room in relation to perinatal mental health, so things like difficult conversations, so you've got that safety of the room and the fact that, if you wanted to talk in private or to talk about difficult conversations, we have got somewhere separate that you're not going to be disturbed by people coming knocking on the door, etc. With the placements, you start with the basics of looking after somebody who's pregnant or somebody who's just had a baby, or looking after the little one. The next year we get a little bit more complex and go look at things like the additional care, so that might be babies in special care, it might be mothers who've got conditions that need a little bit of extra help and support. And then third year brings it all together, where we're looking at placements where basically the student, with the support of a practice assessor, practice supervisor, will start to lead care, and they develop the care plans, and they'll have a group of pregnant women that they look after as well themselves. We need somebody who is willing to learn, also willing to ask for help and for the support that's available for them, but it is an exceptionally rewarding career, and it is a fantastic course. Not often do you get the opportunity to be part of something that's so special, so life-changing really.